Thank you. It's another Foxy Moms Wellness Wednesday. It's been so dry lately, you may be suffering from dry, itchy skin, but could it be a skin disease called eczema? Dr. Eric Kaplan with Colorado Springs Allergy and Asthma Clinic is here to explain. Good morning.
Good morning. How are you?
I'm doing well. I've been a little itchy, I have to say. You know, we kind of suffer from that being in such a dry climate to begin with.
Yeah, no, it's been so dry out there. It's really been causing problems with our patients with eczema, especially this year and this winter. You know, we always talk about eczema as the itch that rashes.
Okay.
So it's that itchy skin that all of a sudden, once you start scratching it, can rash. And then the dry skin and the dry weather that we're seeing right now is making people itch a lot more. The more they scratch, the more that eczema comes up.
We have a graphic to put on the screen, kind of show you some of the symptoms that you may have eczema. You mentioned that red itchy rash, and it's just very irritable, the skin, right?
Right, so you get a red kind of thickened skin, and it's very itchy. For infants, it's usually on the cheeks a lot, and then sometimes the extensor surfaces of the arms and legs, and then on the trunk. As we age, we tend to get it in more classical regions, so the flexor surfaces of our elbows and then behind our knees. We get that really itchy rash that gets very thickened and red.
Yeah, and if you scratch it a lot, it can cause blisters, right? You can kind of get kind of a clear or yellow fluid that kind of comes out of it, which means it could be infected.
Absolutely, yeah, and so we try to find what triggers are there so that people don't scratch in the first place. You know, and food allergies are something that we see, especially in infants and young toddlers. Foods like milk, egg, wheat, peanut, and soy are the 5 most common ones. But some studies quote those statistics as high as 30 to 40% of kids with poorly controlled eczema do have food allergies.
That's interesting, because a lot of times you don't think about, you know, just a dry, itchy rash having to do anything with something you're ingesting, but that's very much the case.
Correct, absolutely. And if you're having eczema that's difficult to control, you need to get in and get tested. Diagnosing food allergy is not as simple as doing a skin or a blood test. You need to have a clinical history. So you cannot diagnose that food allergy just with a positive blood test or a skin test. We need to sit down with the patient or the patient's mom and figure out a clinical history. Some of those moms that want to continue breastfeeding, even though their children have eczema and some food allergies, they can take those foods out of their diet, continue to breastfeed the child just like they want to do, and then we see that eczema clear up. So we can get some nice clinical histories to go along with a positive test.
Obviously children are some of the leading sufferers of eczema, but adults can get it too, as you mentioned.
Absolutely, yeah. In adults, we see some food allergies still be prominent, although not as high as we see it in the kids. And so for the adults, we really try to take that history first. If they're having some foods that flare their eczema, that make their eczema worse, then we really want to try to test them and figure out what those foods are and what the triggers are.
So what's the treatment then?
Well, so we try to moisturize the skin. You know, so we try to have people take baths rather than showers. If they could take a bath every single day, that would be great. Water used correctly as a moisturizing agent, water used incorrectly as a drying agent. So you see a lot of confusion out there, and a lot of people will be told only bathe a couple times a week. But if you can try to soak in a tub, plain water, 20 minutes every single night, get out, pat dry with a towel so the skin is still moist. Put your medicated ointment on the hot spots of your skin, and then put a nice moisturizing cream. We really like Vanna cream. Some people like Aquaphor for the kids. Right on that moist skin, put your pajamas on and go to bed. You'll moisturize all night long.
Feel so much better. Let's put up some information on the screen because you have a website, which is?
We do. So we're csallergy.com. We've got a lot of good tips and things that we see, services that we offer. So we have help for everyone out there with allergy and asthma issues.
All right. Don't want to be doing this anymore.
No,
You know what I mean? All right. Dr. Kaplan, thanks so much.
All right. Thank you. Appreciate
and we'll be right back.